Today we'll talk about the UK-based organization that is yes, National Institute for Health and Care Excellence. This organization provides information regarding healthcare. So they say that certain problems regarding the ear, nose, and throat, if these problems are actually observed for the very first time, means in their acute state, they will just go on their own. I mean, you will feel okay then after this duration, that is 4 to 21 days. If you feel these complications suddenly or for the very first time, this means that these are actually self-limiting, means they don't need any kind of medication for the treatment. Well, if you feel a kind of problem like irritation in your body, you feel discomfort, so you want to take yourself to an easy zone or to comfort zone. So for that, then you have to visit your healthcare provider for the OTC medicine. So those OTC medication will take you to that perfect comfort zone that you want actually. By the way, they are self-limiting, means you don't need to take any medicine for their treatment. They will go on their own. And NICE mentions this particular duration that a person will feel okay without using any medicine, because this is the time period. After this time period, this disease will go on its own, means a person will be free then from the disease, from that particular uneasy condition. Like if you feel pain in the ear for the very first time, if there is a kind of fluid secretion from the ear, hearing problem, means if you feel hearing loss, okay, kind of fever due to this pain or particular conditions. So these all are the conditions or symptoms that are actually self-limiting, means they will go on their own. You don't need to take any kind of medication for that. But if this kind of complication or these complications are actually seen by you, observed by you time and again, then this means that there is a problem. For the very first time or very sudden complications, there is actually not a big issue. This is not a big issue, okay? So then we have regarding nose. If you have sinuses or rhinosinusitis, by these actually we mean that if you have a stuffy nose, blocked nose, runny nose, and means complications regarding your nose. So if you feel for the very first time, then it's okay. You need to wait for certain days, and if again it repeats, means if it is repeating time and again, then you have to take medication and you have to go to the healthcare provider for the proper treatment okay. Well, we have another that is regarding throat. If you feel throat complications, irritation in your throat, pain in your throat, and when you swallow something you can't swallow properly, you feel discomfort, and along with that, if you feel discomfort because of tonsillitis, so problem in the tonsils, problem in the throat, irritation, pain in the mouth, so all these conditions are actually self-limiting. They occur because of certain reasons, and then they go on their own, means you feel okay after the passage of certain days, means there is a specific duration for all these problems. They occur because of certain reasons, and then they stay for certain days. After that, then there is nothing, you will feel okay. So what are the days? About 4 to 21 days. So if you feel all these problems time and again, means there is a kind of repetition observed, so then this is actually a serious matter. You must not wait then. But if you are feeling for the first time, then it's okay, it will go on its own. You can take medication for this, but you are advised not to take. But if you feel discomfort and you want to make yourself easy, then you can take some kind of OTC medication from your healthcare provider. Otherwise, it's okay. Well, we have another problem that is regarding tooth pain or teeth pain. So what people do, they take painkillers. In all those conditions, one can take painkiller, but regarding tooth, if you take painkiller, it's okay, your pain will subside. But remember guys, one cannot take painkillers more than 3 or 10 days, okay? If you exceed painkillers than 10 days, remember guys, there is a possibility that you will drag yourself into complications, means you will feel then complications regarding the stomach, the kidney, and lungs, etc. For the mechanism of action, for more, if you are a science student, you can watch our videos on the topic that I have actually made a video, asthma induced due to aspirin, or aspirin induced asthma, or aspirin induced ulcer. So aspirin, a kind of painkiller, a kind of blood thinner, but this can cause you complications. Along with there, we have some other medications in the NSAIDs, I mean the painkillers, they can cause you certain other complications. But it is suggested that you guys, in case of teeth or toothache, you must visit in the very first priority to your dentist. But in case of these, if you have feel complication for the very first time, then you can wait for certain days. If you are feeling complications like these time and again, then don't do a wait. Just move to your ENT specialist and sort out the problem, what the problem is, and resolve that. That's all from my side. Thank you for watching Dr. Tutorial Lectures.